Welcome to our bite-sized video on the Axial Spondyloarthritis Playbook, reducing time to diagnosis and improving the patient experience. My name is Harriet Goodison and I work as a First Contact Practitioner, or FCP, in West Yorkshire. I also have some lived experience of Axial SpA as I received an SpA diagnosis just a few years ago. The NAS Playbook provides a clear step-by-step checklist for clinicians to use and follow, ensuring that all clinicians within primary care settings are aware of SpA, aware of the tools and resources available for both identifying and managing Axial SpA, and what to do if they are suspecting a possible Axial SpA diagnosis. I have had the opportunity to discuss and share the playbook within the Primary Care Network, or PCN, in which I work, and this has created some great discussions between the clinicians. I would like to share the playbook with you and explain ways in which you can utilise and share the playbook within your practice. How to use the playbook. This guide provides a best practice approach to support you in reducing the time to diagnosis in Axial SpA locally, as well as the essential support that patients should receive when they are diagnosed. It is organised along key sections of the pathway and provides checklists against which you can assess your current practice, resource links to take you to guidance, templates, tools and case studies. Here we have a checklist for primary care, as well as some educational resources and triage tools. On the left is the checklist, covering the following suggestions for primary care. To ensure that there is a programme of primary care education and training on Axial SpA through local or regional in-service training delivered by rheumatology or primary care experts. That primary care has access to electronic tools that can help to identify patients that might have Axial SpA. That there are clear local processes for referring patients to rheumatology, which includes advice and guidance where possible. And that referrals from primary care into rheumatology should contain assessments of patient symptoms using tools such as the NAS symptom checker and the SpA tool. And primary care professionals should consider physiotherapy or NSAIDs if appropriate for symptom relief, whilst the patient is waiting to be seen in rheumatology. On the right, there is a list of helpful resources and tools to aid your assessment for Axial SpA and potential referral onto rheumatology, including the Get It Right First Time pathway, NICE guidelines for spondyloarthritis, and the SpA tool, which can be used to help understand the probability of Axial SpA in your patients. It also includes the Ardens template. This template is a great template that's readily available so that you can ask inflammatory red flag questions during any back pain assessment. There are also some example case studies and publications you may find useful to read through. Here you can access the Getting It Right First Time Axial Spondyloarthritis pathway. With the primary care element highlighted here on the left of the slide, this includes a list of screening questions to ask your patients during your assessment before going on to complete an advice and guidance or rheumatology referral depending on your local pathways. These questions should include the duration of symptoms, family history, history of psoriasis or inflammatory bowel disease, and the patient's response to NSAIDs. The referral or advice and guidance may also include any results of blood tests or imaging the patient may already have had done that supports their diagnosis, their employment and normal level of physical activity, the impact of their current symptoms, and whether they are a smoker. The link at the top of the box will take you to the NAS symptom checker, which we will go on to discuss later. This link takes you to the current NICE guidelines and shows a great infographic which can be printed out and kept for reference if needed. This image was well received during my presentations at multiple practices within the PCN in which I work, as it includes the key questions to ask and lists many possible symptoms, all put into an easy-to-follow flowchart. Management advice is also included on the poster, suggesting physiotherapy and medication management. I would recommend sharing this with colleagues as it's a very useful infographic to have available. Our primary care education PowerPoint is available here, which you can use to deliver education sessions within your primary care networks. Some people have done this as a part of their protected teaching time slots, while others have carried out lunchtime training sessions. For those who have found it difficult to deliver sessions in person, they have recorded training videos and emailed them out to the clinicians within their network. The presentation has been compiled with healthcare professionals working in primary care. As I have already mentioned, I have had the opportunity to share some of the Axial SpA information within the protected learning times at multiple practices within the PCN. I utilised this NAS PowerPoint for primary care as part of these sessions, as well as adding some of my own patient case studies. The NAS Symptom Checker, which combines 3 sets of validated criteria, can be completed by patients with chronic low back pain. Please see the public awareness videos for more information. Correct responses to 5 or more of the 8 questions should warrant further investigation, and they will receive a message encouraging them to make an appointment with a primary care clinician. The symptom checker will issue a PDF for them to bring along with them. Having the poster up in clinical rooms is also a great way of directing patients straight to the QR code so that they can complete the symptom checker with you in clinic. In addition to having posters up in the waiting room, some FCPs have sent the link to the symptom checker out to all patients in the practice with chronic low back pain via the practice messaging service. More information on this can be found in the Stoke case study, which is linked to as a resource in the primary care section of the playbook. This is something I am currently discussing with the GPs I work with. It has also been suggested to share the symptom checker on the individual practice and PCN social media platforms. Axial SpA, what are the key symptoms? Here is a list of the symptoms checker questions. So back pain that started before the age of 40, back pain that's developed slowly, chronic back pain lasting greater than 3 months, back stiffness upon waking, back pain that improves with exercise or movement, back pain that's worse with rest, alternating buttock pain, and regular waking at night time. Electronic tools such as the Ardens template, which are embedded on the IT system, can help identify people with possible inflammatory back pain. If the local IT system is not compatible with Ardens, then contact Gold Standard at nas.co.uk to explore other options. As mentioned earlier, I use the Ardens template for all of my MSK assessments, and this includes a list of inflammatory red flags. I would highly recommend this template, and it is something I have encouraged the GPs to use whilst assessing those with low back pain in their clinic. The SPADE tool has been designed by Professor Raj Sengupta and his team at the Royal National Hospital for Rheumatic Diseases in Bath. It is designed to assist medical professionals to define the probability of axial SpA in patients with chronic back pain below the age of 45. It takes a couple of minutes to complete and gives guidance as to next steps. It can be included as part of the referral to rheumatology. For cases which are more uncertain, the Get It Right First Time have developed an advice and guidance template which can be accessed via this link to the NHS Futures platform and can be used to obtain information from rheumatology as to next steps. If you do not have the option of advice and guidance in your locality, then other options are establishing links with the rheumatology team to discuss the local pathway and referral requirements. I am currently arranging to meet with the rheumatology team in my area to discuss our pathways and what they would like us to include within referrals. Spending time observing rheumatology clinics is also something I am looking at arranging. This will allow me to see what the rheumatologists incorporate into their assessments. While waiting for rheumatology appointments, patients should also be signposted to the physiotherapy team, and NSAIDs should be considered if appropriate. As an FCP, I can arrange medication reviews and prescriptions with the GP, as well as providing exercise advice and education alongside physiotherapy referrals. If you would like to discuss the primary care section further, please contact goldstandard@nas.co.uk. Thank you.